Everybody comes in with sleep score. They look at their iPad. It's like a gamification of healthcare.
Welcome to the You're Doing It Wrong podcast. Today I've got board certified sleep specialist Dr. Alex Hakim joining me for a drink and a chat. Welcome, Alex.
Thank you for having me.
I think you've got meetings after this, so you're only drinking water, aren't you? But I've got a whiskey to enjoy our chat with.
Very good. I should be drinking warm milk as a board certified sleep doctor. That should be the beverage of choice.
Is that mandatory for all sleep doctors?
Oh yeah.
Warm milk, huh? Warm milk and honey.
Mm-hmm.
Alex, you've got several specialties, not only sleep, but give us a little background on all your other degrees and medical experience.
Yeah, I'm board certified in internal medicine. That's usually the general doctor route, and there's a lot of subspecialties that branch off of that. So I started there and went to sleep medicine. I didn't know if I was going to actually be using it. It just seemed like a nice fellowship at the right opportunity at the right time. And I had a passing interest. I had no idea that it would be such a life-changing experience. And I would come to self-diagnose myself with most of the conditions that I was taught to treat. So that was also fascinating.
Yeah, I think a
And,
lot of people probably have sleep problems that they probably haven't brought up with their doctors.
Yeah, and a lot of people have sleep problems and they're listening to us right now and they don't even know that they have sleep problems. I think that's also including myself,
Mm.
I was looking at that field as like, oh, I can help some people. I looked at my parents who was sleep apnea sufferers and I said, oh, I could probably help people like that. I didn't know that I myself would be so afflicted by sleep apnea.
Mm.
But then I went to critical care and I went to pulmonary, which are usually combined in the United States. So lung specialty and ICU specialty. And that was always my goal from the beginning, was to try to save someone's life. That was definitional for what is a doctor. Somebody who faces life and death challenges and has to deal with it. And for 10 plus years I've been running an ICU in Torrance, California, and I made a big separation from that, the stability of shift work, to focus on sleep medicine.
Yeah, that's great, Alex. I know that you spent a lot of time in the ICU. That also opened up a few other doors for you over COVID. I believe you were on several news channels
Mhm.
doing the COVID reports. How was that?
It was an interesting time because I had been practicing ICU for such a long time, and like I said, there's just a thrill of trying to save someone's life. I would come home and tell my wife, like, you never believe what I just did. I was so enthused for the things I was accomplishing, and then I would go to work, and it was as if none of that ever happened. And so I'm like, this guy doesn't even know what happened yesterday. Like, that was crazy. There was code. They were like about to pronounce them dead, and they came back to life, and even the patient had no idea and the family has no idea. And then to go
Yeah.
from like just being like an anonymous doctor to suddenly people actually knowing what the ICU was and who I was kind of exciting. And I took that opportunity to try to educate people about what's happening in the ICU and what end of life really looks like in the United States.
Yeah, that's a very different than what you've just started now, which is Sleep Doc LA. T Tell us why you wanted to step away and move into this new chapter.
Yeah, I think after seeing so many people die and seeing so much suffering, there were the opportunities to really make an impact to save someone's life. But more and more, I was noticing that the ICU was full of people that even when you made huge impacts on their immediate outcome, they would just come back, a few weeks later to the ICU to pass
Mm.
away. Just because that's the nature of ICU these days. The safety net is actually getting better. And so instead of getting very reversible cases of very critically ill people, you were seeing people that were just destined to die no matter what you did and no matter what treatment modalities that they were undertaking. This was really just the last gasps and the last stages of people's lives. And so, from a mental health perspective, just seeing constant futility, trying to explain to families about being realistic about what the ICU is capable of doing, sometimes having to unfortunately be a vehicle of lowering their expectations of what's possible. It's really it has very negative effects on the human psyche to have to engage in that all the time. And right around that time, this was maybe 3 years ago now. My dad had a stroke, and my dad's a super healthy guy, is a retired surgeon, didn't have a whole lot of medical issues, and except for sleep apnea, except for gasping at night.
Okay.
And I don't think I appreciated it. I was watching him at the rehab facility for physical rehab, and he was gasping away, snoring, and really fighting every breath. And it was really eye opening for me to see. And by extension, I remember all of these people in the ICU similarly afflicted, especially in the context of stroke or major cardiac issues. And I started to think more proactively about healthcare and to try to change the way I was thinking from, making people sober and realistic to the horrors of end of life to making people excited and upbeat about, potential treatment plan that can not only help their longevity in terms of prevention of stroke, but also
Yeah.
from a quality of life standpoint.
Yeah, yeah. I think that's always been a problem with Western medicine. A bit is it's reactionary versus preventative.
Hmm.
Um, I think there's definitely looks like it's trying to. I think insurance companies are realizing as well, right? That wellness is a better has a better result and is better on the bank account for them than just treating all these problems that occur if somebody's not taking care of themselves.
Yeah.
Um,
In the right hand, treating sleep apnea, for instance, the outcome could be less blood pressure medications. The outcome could be less diabetes medications because those things, blood sugar, blood pressure, they tend to get better when you restore the natural breathing at night. And so very few fields can take the honor of reducing people's dependency on prescriptions that treat the outcomes of disease and not necessarily the cause and the origin.
yeah, no, that's great. So now to the nitty gritty. Tell us what we're doing wrong. Uh, gi- give us give us your top five or top three. What are we doing wrong here?
Well, I mean, the first thing you're doing here is scoring, the top this, everybody comes in with sleep score. They look at their iPad. It's like a gamification of healthcare. It's like,
Yeah,
these top five things, like if you go on Google and you'll see like these five things your doctor doesn't want you to know that will radically change your sleep. I think this is the critical care background in me, is that you really have to work in medicine big to small. What is the most serious, most consequential thing, and what is the least consequential thing? What is the most impactful thing, and what is the least impactful thing? And right now, I went from the pandemic of COVID to, I think, another pandemic, and I'm not the first person to notice this, but of just horrifically bad, not recognized sleep apnea, in
mm,
addition to insomnia, which we'll talk about, especially in young people. But when it comes to breathing, you'll see people like micromanage like melatonin and these herbal remedies and this type of pillow, and they saw some gadgetry on an infomercial at 2 in the morning. Like you combine all of these like rearranging the deck chairs type of thing, but you're missing the fact that some of these people that I see, they're not breathing for like 40 events, 50 events an hour. Their oxygen
wow.
is dropping below 80%. They're just gasping all night long, and they're talking to me about all sorts of like minor adjustments. And the gamification, the wearables, the gadgetry that we have can give people a false sense of security. They'll come to me and they're like, well, my sleep score is above 90 on my Whoop and my this and that. And I'm like, they're not tested on people with sleep apnea, and they don't have the resolution to show you that you're having this disruptive sleep. And so I think the first thing that we do wrong is we miss like these vital things that are happening to us at night. Mainly because we have no recollection of what happens at night. We're by definition unconscious during that. So if you're unconscious, how can you possibly know that you're gasping? And some people take offense to that, where I'm like, well, that's your opinion. They'll say like, oh no, I'm not doing those things. I'm like, thank you for that opinion. But one of the things you're doing wrong is you're overestimating your ability to be aware of what's happening at night. I'll give you a quick example. I had a patient yesterday. He's like, well, I wake up 3 times a night to go to the bathroom. I'm like, well, it could be that you're waking up, you don't know why you're waking up, you feel your full bladder, and then you go to the bathroom. You expect that that's the reason, but you're not totally aware that what's really waking you up. And the guy said, no, 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 it's because of my going to the bathroom and all that. Like, sure enough, this guy has really severe sleep apnea. Everybody knows it, but he's just convinced that he's waking up to go to the bathroom. And
Hmm.
so there's not a lot of professions where you kind of have to go against someone's own senses and their own awareness of things and convince them that something completely different is going on at night.
Well, you mentioned a couple of these things, like the different uh, things you can buy now to monitor your sleep. Uh,
Hmm.
what is that? How is that different? I mean, you said that they don't have the resolution. They're not really probably monitoring your oxygen levels. They're not.
Hmm.
I wouldn't think that they. Maybe they monitor your pulse. I'm not sure, but not sure what else they're missing. Can you go into a little bit more detail on that?
Yeah, this is something that I'm going to have to make a video about soon because, even Apple is touting their sleep apnea detection in their newest device. And if you actually hear about the way they're trying to do it, is they're trying to summarize movements. So most of these are actigraphs, which are movement detecting devices,
Yeah,
and they're trying to summarize 30 days of movements. So you basically would wear the watch for 30 days, then feed that movement data to an algorithm that's looking for twitching and jerking that might correspond to the rhythm of sleep apnea. This is a very convoluted way of coming to something that a very cheap device on Amazon. Like if you go right now and type WELLUE, they have like some devices that are wristwatches and rings. They have
yeah,
a high resolution pulse oximeter. So they can show you the dips and valleys of someone's oxygen. Cyclical, we call it cyclical because it's like rhythmic during certain periods of your sleep that would suggest potentially sleep apnea. It could miss, so it's not everything looking at someone's
right.
oxygen because some people they don't drop their oxygen. But I mean, it's like an order of magnitude more effective than just about any wearable that you can buy. Just looking at a high resolution oximetry of somebody overnight.
Yeah, no, it's I know that Apple is definitely tooting uh, their healthcare benefits of wearing their watches, but yeah, it looks like for sleep, there's probably some better options out there. But
Hmm.
um, what about? I mean, we talked about melatonin. So, what are your thoughts on melatonin there? And also for my, I've uh, I've got kids that uh, there are times when, especially jet lagged, if we've traveled or summertime when the sun's out till 9 p.m. and the kids don't want to go to sleep and we've had some problems. So we've on occasion given them melatonin or just a little bit. And uh, what are
It
your
makes
thoughts on
sense.
that?
Well, melatonin definitely makes sense given the amount of sun in your region at that time. Melatonin is good in that regard as a reinforcer of sleep wake cycles. It's not just a drug that someone takes to make them fall asleep because it won't be as effective if given at off periods of time. Like you can't just start taking it at 11 a.m. and hope to go straight to sleep. It's not a
Mm.
sedative in that way. It basically reinforces a sleep wake cycle. And if you take it at the right time, you can slowly shift somebody's sleep wake cycle so that they go to bed earlier. So that's a perfect example of where melatonin would be valuable. So that kind of keys into what we call circadian rhythm. There's two things that kind of reinforce sleep wake cycle: your level of activity during the day and your light exposure. And light exposure is what modifies the melatonin that your own brain generates. And one of the things I like to do to reinforce the sleep wake cycle is using a light box. You can buy those on Amazon for about $50. You set the alarm,
Oh yeah.
like an hour before you want to wake up. And even that effect of just having it behind your eyelids as you slowly open your eyes in the morning at that level of power will reinforce that sleep wake cycle. It'll make you feel more tired earlier. So that's another way of doing it. And a third way would be reducing light exposure more profoundly in the dusk. So, because you have a lot of light in the afternoon where you are, you might want to put on some sunglasses. You might want to put on some blue blocking sunglasses if you want to be able to see more clearly.
Yeah.
But that also definitely has a strong effect on your endogenous, your body's natural melatonin production. That's a big difference between taking a pill melatonin, because you don't know how much is in that pill. You don't know how much is going to be absorbed. And then once it's absorbed, you don't know how much of that is going to even penetrate into your brain.
Hmm. As I've got a little bit of whiskey here. Um, and I know that others probably drink or like to have a little drink before bedtime.
Is
Um,
this
how does
sponsored by
that?
a whiskey company? This.
Yeah, well, it's I've had a bit of a cough, and
Mm.
it's my favorite cough medicine. So, but I know that if I've had a bit too much to drink, obviously I sleep terribly, but a little bit seems to help put me to sleep. But any thoughts on? I'm guessing alcohol in moderation at all times, but does that do you see that in your patients a lot? Do they have uh, is alcohol causing a problem with their sleep, or is it just a symptom maybe of sleep apnea that they've had before, and then they try and self medicate using that?
In my patient population, not quite. Most of the people who I have are very conscientious about trying to make their sleep habits work. And so they're going to stick to routines. They're going to be sticklers about certain things, including avoidance of alcohol. And I'll talk about its effects on sleep. But like the replacement for alcohol as a sedative in Los Angeles, California, as of right now, is definitely medicinal marijuana by like orders of
Mm,
magnitude. And so even you'd see like people like 60 plus years old that you never think would go to dispensaries, and they're totally versed in the lingo, and they have all sorts of experience. They teach me regularly about all the different varieties and things that you can do. And but when it comes to alcohol, it is a sedative, so people will feel tired if they drink enough. The problem is it's a sedative for the first few hours, and then as it's being metabolized out of the body, it tends to give people energy.
mm,
And so people can wake up, 5, 6 hours after a glass of whiskey. It really depends on the person's body and metabolism. So that's kind of like if you ever see those people that like drink so much that they go from lethargic to energetic. It's like
yeah,
you drink past the point where it's starting to metabolize out, and it can actually feed into instead of being a downer, being kind of an upper for people.
yeah. Well, I know at about 2 a.m. If I've had a few drinks before bed, and at about 2 a.m. I'm up and I'm running. I'm like I'm wide awake. I'm not getting back to sleep.
Hmm. So you
Yeah,
experience that too, huh? And I always
yeah,
tell myself it's not going to happen, and then it happens every time. I'm like,
yeah.
but I feel so relaxed, and it's such a and it's a form of hypnosis. A lot of the things that we do are hypnosis treatments. So alcohol really kind of relaxes you. doom scrolling on the phone, where you're just like scrolling
Mm.
aimlessly, or watching a movie aimlessly. These are ways that we hypnotize ourselves to sleep. And that's kind of where I was starting to touch on with this insomnia epidemic, I would say in 35 and younger, because they're so dependent on these devices to really cause them to relax and to distract these internal monologues that they're having with their thoughts. And so they need it. They depend on it. And I have a quick, interesting story. When I was at the VA and I was seeing patients about 15 years ago, I would see. I had a patient in particular that really left an impression on me, who was telling me he was going crazy at home whenever there's a power failure. And I was like, that doesn't make sense. And then he explained to me, he's a frontline soldier. He explained to me that if he's not listening to the TV or the radio or the music or whatever distraction, all these racing imagery and thoughts would come out about his experience in the war,
Wow.
the things that he saw and the things that he did. And I realized that he's deferring this internal monologue, this emotionally impactful monologue that he needs to deal with, his subconscious. He needs to address it in order for him to be able to sleep, or else he's dependent on these devices to basically distract himself from those thoughts. And that was like the first time I was seeing that. And sure enough, I see the kind of signs in my young patients. I'll tell them, can you go 10 minutes with no distraction, with literally just you and your thoughts? Because if you can't do it during the day, then how do you expect to be able to do it turning off the light and putting your head on the pillow? If you can't do it,
Yeah.
then you can see where the problem is.
Yeah. No, I'm guilty, I think, as well as
Mm-hmm.
I uh, I like word games to just zone out and play the word games before I go to bed. It just kind of helps to you know
It's
relax me.
hypnosis, and if you've
Yeah.
seen enough movies, you would think that you have some like deep dark secret that you don't want to think about. You know, that would be like the movie script version of that story, or the what I experienced with that guy in the VA who just had so much horror in his life. But honestly, it's a normal daily function of the human brain. You have to have this internal monologue. You need to deal with emotionally impactful thoughts and situations that you experience throughout the day. You catalog it, you organize it, you come up with a game plan, you process it, and then you'll find your subconscious is no longer intruding into your attempts to fall asleep.
Mm.
And that's such a necessary thing. The fact that people are incapable of doing it is a little bit scary, because what happens is, it just builds this baggage over time of all of these things that you're hanging on to. This is the category of thought, we call it mindfulness. And there's a lot of activities that are mindful activities, like journaling. So if you don't want to
Yeah.
just passively meditate, you could start writing your thoughts on a piece of paper. And, what happened during the day? What do I think about my coworker? What really pissed me off? And sometimes
Yeah.
you look on that piece of paper and you see things that you never thought you'd see. You'd see things of your subconscious just kind of emerging and throwing itself onto a paper in anger or disgust or happiness or sadness or gratitude. People pray, and people they have confession, they have silent meditation, they have yoga. These are all things that I think really help get the brain centered and prepares it for your night ahead. Some people do like long hot showers before they go to bed, and they think like,
Mm.
wow, it's the hot water on my body that's got me ready for bed. And it's really just the silence for 20 minutes that's helped them.
Yeah. Well, your best thinking's in the shower, right?
Hmm.
It's,
Embrace it.
yeah.
Embrace that subconscious.
No, that's good recommendations. Also, my kids, so they love to listen to audiobooks as they go to sleep. And I don't know
Wow.
if that's good or bad, especially the Harry Potter, because
Do not let them
it's
do that.
yeah.
Please do not
So,
let them, for God's sake. No, quiet time is good. In fact, my wife is like, I think it's the our wives that do maybe do that, but they're like, oh, he's just sitting there doing nothing. Here's a book. Here's a this. I'm like, no, sometimes you need to sit and do nothing.
Just sit and quiet.
You
Yeah,
don't
it's
have
good.
to stimulate yourself all the time.
Going back to sleep apnea and snoring, I've got as a spouse of a snorer.
Mm,
Um, how does that well as I've found some other things out recently, so I was going, how does it affect spouses? So I know for me, uh, so if my wife comes in while I'm trying to fall asleep, she comes in, falls asleep within 60 seconds, and then 60 seconds later she's snoring, and then I've like messed up my whole falling asleep thing, and so I've got to kind of go back through and try and get my brain and body ready to go back to sleep, and that's frustrating if I'm snoring. And then same thing if I wake in the middle of the night, you know that same sort of trying to restart that cycle, but if your partner's snoring, it makes it more difficult. So the, any thoughts on that? Do I need to give her a sleep exam and a CPAP
maybe.
machine?
First of all, there's a lot of single people out there who have no idea how bad their breathing is because they don't annoy somebody in their bed.
Mm,
And one of the things that has been very valuable is that spouse that notices something's wrong and comes to get my attention because there's something really ominous going on. There's gasping and so forth. And so I would encourage people, if they see something that doesn't look like just a run of the mill snore, if they see them stop breathing, for instance, if they
yep.
see really loud gasps every once in a while, if they see that they're tired during the day or they wake up in the early morning and unable to go back to sleep, these are some of the red flags that I see. And what happens eventually, because people don't really know what sleep doctors are, or they're unable to get access to sleep doctors, what happens eventually is they separate. They leave the same bedroom into two separate bedrooms, and I think they enjoy that whole bed to themselves, and like they're back in their like single life mentality
Mm,
sometimes, and it's hard for them to go back to sharing a bed with somebody. But it definitely hurts the intimacy in a lot of relationships. I
yeah.
never heard this term before, but everybody seems to ask me about this term called sleep divorce, which is the language that people use for that separation
Well,
between a husband and wife from the sharing a bedroom. So I do get excited personally about trying to get people back into the same bed and being able to reduce the noise. And we can talk about some basic things, but I think that distress is really real, and there's a lot of people that are dealing with
yeah. So I should just poke her till she wakes up, right? That's
it.
and then I can fall asleep
That's
again.
so unscientific. Well, one
Uh,
thing you can pay attention to, you are a sleep study in your own right. See if she gets better on her side. See if there's a position that she likes more, propping up her head.
yeah,
Seeing if she's mouth breathing. There are some trials of mouth taping that you can try. There's certain products out there. I know that's all the rage, but it's highly specific. That's my warning. If somebody loses their flow of air through their nose at night, you really don't want to put tape on the mouth. It's not a good
yeah,
idea. But for all the other people, sometimes a snore is only a few millimeters of backward protrusion of the tongue. And when you
mm,
close the jaw, you bring the tongue a few millimeters forward, and sometimes that's all it takes to eliminate a snore or a gasp.
well, yeah. Learn something every day.
Oh yeah, I mean, there's so much to learn, and there's really what I say in Los Angeles. There's not an empathy problem where I am. There's an insurance problem. And wherever the financial support is for whatever industry, it grows, and there's all sorts of innovations. if you're a plastic surgeon in Los Angeles, you have like what amounts to alien technology in your
Mm.
office with like the best of everything, the best waiting rooms, the most
Yeah.
impressive offices, and so forth, because they're compensated in kind. But sleep medicine historically has been very poorly appreciated and poorly compensated. And so we've kind of had a dearth of discoveries. So I guess what's unique about my practice is I'm trying to put a financial incentive for me to spend very significant periods of time with patients to treat it as seriously as people believe it is. That's one of the things about sleep. It's like, if historically when someone snores, when someone gasps, it's like a comedic sound that people love to laugh at and make fun of people for it. But when they see now the devastation that comes from sleep apnea,
Mm.
we don't necessarily treat it with the urgency that it needs to be treated. So, and I think part of it is the compensation. Nobody really wanted to go into sleep medicine because they don't see it as a lucrative career path. It's not compensated. The attention is not there. And as much as I hate wearables for giving a false sense of security, it is bringing attention to a field of health that is sorely lacking. The more attention you give it, definitely you get better results from that.
Yeah. Let's go on wearables for a second because I think
Mhm.
that's, I mean, you've got a great, uh, a great story and great. I think we've heard why, especially if we have a spouse or someone that needs a sleep study or to see a sleep doctor. You know, I think it's been really eye opening on things. But at the same time, yeah, I want to get your view since I know you love technology.
Mhm.
You're a bit of a tech geek, I think, through the years that I've known you. And what do you see? I mean, I see that AI is popping up in everything these days, and I know in healthcare, a lot of AI is focused on yeah, imaging, like medical imaging, and being able to diagnose things through imaging quicker than humans. But uh, and I know in the medical field, it's moving every day. But I guess what's your view on things like the Apple Watch, these wearables, and then where do you see uh, yeah, the medical devices going? I guess with health or
Yeah.
with sleep. Sorry, yeah.
I kind of told you about my annoyance with this current generation of devices because you need to have a certain amount of refresh rate on a device that you wear to detect sudden drops in oxygen. So Apple has pretty much eliminated their oximetry data from their devices, and the rumor
Hmm.
is that they're not paying a license for it. Um, but the other issue is that it requires tremendous battery power to be able to get a high refresh rate, both on their algorithms for detecting sleep and wake, as
Right.
well as for the resolution of heart rate and the resolution of oximetry. I use a device, and the gadget that I love using for my patients is a sleep study that someone can do in their own home. I set it up for them. It's a wristwatch and a finger probe and a chest sensor. Literally nothing is going over your face. Your phone is the conduit for which the study is transmitted to me wirelessly, and then even more incredibly, it's disposable. You get to throw that thing in the garbage when you're done,
Wow.
like something that complex and sophisticated. And I find that some of my most challenged patients can perform it very well as long as they remember the App Store password that they need to log in. um, but there's such an opportunity, hopefully in the near future, to provide more consumer-facing devices that have the resolution to make these diagnoses. I think it's a good thing for philosophically that they can catch these problems. But then the next question is, what do you do with the identification of these problems? And right now, most of the people who are in significant distress have significant sleep apnea. And there's really only one thing that is going to treat significant sleep apnea, which is CPAP. And that's a whole other technology industry that is not able to grow very far with the current crop of masks and machines. They've kind of, ResMed in the United States is dominating in terms of their industrial design. Their masks are
Hmm.
as lightweight as can be. Their machine is as whisper quiet, and their algorithms as effective as can be. The data that it gathers from people, it helps me a great deal for micromanaging my patients. But at the end of the day, there's still something bulky that's on someone's face. At the end
Yeah.
of the day, you're breathing against resistance. It's not a free feeling of breathing, and that takes some getting used to, and that's a little bit of an understatement. It's cosmetically ugly for young people to wear. They feel embarrassed to wear it. Um, and a lot of it requires hand holding, which is something that I am focused on, but a lot of it also requires patience and self exploration and all that. And if you're somebody who's 65, 70 plus, you might not have the patience to figure this thing out.
Yeah.
And that's definitely something that I really hope that the technology improves a great deal. But going back to wearables, once people realize how many true physiologic problems are driving people's quote unquote insomnia, I think that's going to be eye opening as the gadgetry improves. Like one of the things that was mind blowing to me is how many patients I've had with anxiety disorders who are on a whole host of psych meds, and I get involved for managing insomnia. And because I'm a scientist at heart, I'm not a psychologist, I'm not a therapist, I'm a physician at heart. The first thing I want to do is get data. And so I
Yeah.
usually ask for them to do these sleep studies, and they're, like I say, they're pretty effortless. And there's a huge percentage of people who are diagnosed with severe anxiety disorder, panic disorder, and so forth. And then you see on their sleep study they have terrible sleep apnea.
Yeah.
And the thing is, like, maybe this person just was misdiagnosed. Maybe they had no idea they were breathing so terribly, and all you had to do was put CPAP on them, and their anxiety levels radically improve.
Yeah.
And that's what I'm seeing so far.
Yeah. I know when I was a teenager, I had real problems getting to sleep, and even through my 20s,
Hmm.
for sometimes as well. And the anxiety of not being able to go to sleep would cause me, that was just, it was terrible. So, and the longer I couldn't get to sleep, the worse the anxiety got.
Yeah,
So,
that's that
I can
vicious cycle.
understand. And then, and then that could last for days where you just, it's like, oh no, I've got to go to sleep again. And just the anxiety of trying to go to sleep was so bad that you just couldn't sleep. So,
Hmm.
for me at least, it was the not going being able to get to sleep. But I can understand if you're not getting sleep, or you're feeling like you're not getting sleep, yeah, you're not going to be feeling well the next day.
Yeah. I'm very philosophical, and consciousness is a very powerful tool of the human body, and whatever you put your mind to, you tend to be able to conquer. Whatever problems you're conscious of, you identify and you work on, you can fix. The problem with sleep is the more you focus your mind onto it, especially in the hours right before you're sleeping, or even
Mm.
during the night, it becomes counterproductive, because it's really the realm of the subconscious. It's about making peace with your subconscious, and that's why we do so many ritualistic behaviors around sleep to help people to get their mind prepared. That's a whole art form we call cognitive behavioral therapy. And what, how are you putting your sheets? How is the bedroom structured? What are the colors? What are your, all of these things that you lay out in front of yourself? It's to create a kind of a soothing vibe, and just kind of get that inner child, which is your subconscious, to like be at peace. It's a very different way of thinking about tackling a problem. I know you're like a very goal oriented person, and those tools don't really apply in the realm of sleep. You have to sometimes do symbolic and ritualistic things to conquer such a weird type of disease, which is sleep disorders.
Yeah, well, Alex, anything else? I thank you for teaching me all the things I'm doing wrong.
No problem.
As
I'm gonna appreciate when I send you my bill, and thank you for
well,
participating.
I'll give you my email address.
This is what
It's
a session looks like, with a sleep doctor.
um, so you can reach Alex at sleepdocla.com. Uh, and I've learned a lot about my kids and my wife and and others and changes I need to make. So hopefully you guys have learned as well. Alex, I know you've got to get to your patients now as it's
Mhm.
getting to be bedtime, so you're on call. But thanks for having a drink with me, and it's been great talking to you.
Great talking to you, Christian. Thank you for having me.
Thanks for joining us today, and if you have any questions for the guests, pop them into the comments. And don't forget to like and subscribe.